Multiple points on the ladder, earning more means ending up with less. On paper, that sounds reasonable. In practice, it creates what economists call the benefits cliff, which is one of the most quietly destructive features of the modern American welfare system. Here's how it works. Imagine a single parent with 2 children working full-time at $8 an hour, about $16,000 a year. At that income, the family qualifies for food assistance and subsidized childcare. The system is functioning as intended. Now the parent gets a raise. Income rises to $25,000, about $12 an hour. Gross pay goes up, but it crosses an eligibility threshold and food assistance disappears, taking annual net resources down by roughly a third. That's the first cliff. At around $31,000, $15 per hour, the parent is close to covering basic needs independently, but when the wage rises by just 50 cents an hour, eligibility for childcare assistance is gone. A small raise has triggered the loss of a subsidy worth thousands of dollars annually, sending net disposable income down by roughly 25% almost immediately. That's the second cliff. Continue up the wage ladder and it happens again. Around $22 per hour, public health coverage disappears. Now the parent absorbs private insurance premiums, deductibles, and out-of-pocket costs on top of everything else. At multiple points on the ladder, earning more means ending up with less. The person didn't do anything wrong, but the system just has a gap between where help ends and where standing on your own 2 feet becomes possible. And the people living in those gaps are some of the most financially exposed households in the country. They earn too much to qualify for help, but too little to comfortably absorb market prices for housing, healthcare, and childcare, and they don't show up in poverty statistics at all. They exist entirely in the space between the benchmark and reality.